The relationship between testosterone levels and snoring and sleep apnea is really interesting. Nationally, about 3% of American men are on testosterone supplementation, but at the Snoring Center, almost 30% of the patients that we see are. So why is that? Well, number one, taking testosterone makes snoring and sleep apnea worse. There's actually an FDA warning label on the box to that effect. In addition, one of the reasons that men can have low levels of circulating testosterone is that they're not getting normal sleep, because testosterone production is regulated while we're asleep. So if you have sleep apnea, your testosterone levels can go down. And the position that we take at the Snoring Center is, rather than taking external sources of testosterone, it's better to solve the problem by meeting your body's need for sleep. To learn how getting better sleep can increase your testosterone levels, give us a call.